Joining me live now, Christina Bellantoni, senior reporter for Talking Points Memo. Good morning to you.
Good morning, Alex.
So this time yesterday, people were wondering whether the Democrats would be able to get enough votes to pull this off. So now that it's done, let's get it put into perspective. What does it mean for President Obama and Democratic leaders?
Well, it's just one step. You know, obviously there are a lot more bits and pieces that have to come together on the Senate side in a final bill before it makes it to the president's desk. But it is a big step. I mean, the Democrats are correct in saying that this is a moment for history. They've never gotten this far. And this is a bill that did go through all of the relevant committees. We've obviously been debating it for months and months and months, you know, in town halls, hearing from all kinds of constituents. And they got 2 votes more than they actually needed to pass the thing.
What about the presidential input there? He went to Capitol Hill, talked with Democrats behind closed doors. Did that produce more votes?
It's hard to know. I mean, in these things, you always wonder if people are actually changing their mind at the last minute. The Republicans had some fun with this yesterday, sending reporters the list of Democrats that were going to be voting no and calling it the only bipartisan vote on this bill. Obviously, that's not exactly what happened, but the president gave a message to these Democrats saying the Republicans are going to fight you in 2010 during the midterm congressional elections, no matter how you vote on this. So keep that in mind. You know, don't be on the wrong side of history. And that's a message that Representative Dingell, the longest serving member in the House, also has told Democrats that this is a really important political issue to win on.
Well, in terms of polling, any number of polls out there on the public's appetite for health care reform, some for, some against. In one of the latest, a majority opposes the president's health care plan. So how much will Democrats still need to sell it?
Well, they're going to need to sell it. And this is why you're actually seeing a lot of grassroots groups stepping up today and saying, send your member of Congress a thank you letter for supporting this. I am positive that you're going to see Organizing for America do more of these thank yous to members that stood up. And I'm sure that the lone Republican, Joseph Cow from New Orleans in Louisiana, is going to get some help, whether it's from the president or from grassroots groups. You know, he's going to be supported for being the one guy to cross the line.
Right. What about the GOP? How do they proceed next?
It's a good question. I think that they're going to continue to do this. They had these Tea Party rallies. There was a smaller one yesterday, but the one that they held on Thursday was a large event. They did show a lot of people that are frustrated with the way that government is going. But the way that this works in Congress, it's a numbers game. They don't have the numbers to really block a plan on the House side. So now it focuses on the Senate, where there are a lot of Democrats that don't support the elements of what just passed yesterday in the House plan. The public option in the House plan is fairly, you know, quote unquote robust, as the Democrats like to call it. A lot of moderate Democratic senators say that they don't support that kind of a public option. So there's a lot of negotiating to go.
Okay, Christina Bellantoni, thank you very much for weighing in.
Thanks.